What is the name for the thigh extension of the small saphenous vein? The answer is the Giacomini vein. The persistence of this vein is important because it may contribute to the development of chronic venous disease. Thus, it is critical to assess this during duplex venous ultrasound assessment of the lower limb. This vein courses between the biceps femoris and semimembranosus muscles. It's reported in up to 75% of the population. The name of this vein comes after a famous Italian anatomist named Carlo Giacomini. As a reminder, the small saphenous vein forms part of the superficial venous drainage of the lower limb. It forms by the confluence of the lateral dorsal venous network of the foot, i.e. the lateral marginal vein. It then passes behind the lateral malleolus and directed superiorly in the subcutaneous tissue of the calf, perforating the deep fascia, draining into the popliteal vein and the popliteal fossa. Tributaries include communicating branches with the great saphenous vein, cutaneous venous tributaries, and numerous perforating veins from the deep venous system. The sural nerve often accompanies the small saphenous vein. The sural nerve is a branch of the tibial nerve, by the way. There's also variable termination, which means the small saphenous vein does not drain into the popliteal vein. One variant is the Giacomini vein, which is discussed in this video. This color duplex venous ultrasound shows red signal in the Giacomini vein. Red means flow is directed towards the probe, in this case towards the small saphenous vein. The popliteal vein is flowing in the opposite direction, as indicated by blue. This longitudinal view through the popliteal fossa demonstrates what happens after a femoropopliteal vein thrombosis. Arrows point to septal formation in the deep veins, indicating reflux. The Giacomini vein is dilated due to reflux. The bottom left image shows antegrade upward flow, shown by blue signal away from the probe in the vein of Giacomini. This vein fills through an incompetent saphenopopliteal junction. It is important to assess for variant anatomy because failure to do so may lead to poor saphenous vein ablation outcomes. This axial ultrasound of the proximal thigh, just inferior to the saphenofemoral junction, shows that the anterior thigh tributary, which is a different variant, is much larger than the great saphenous vein. A small Giacomini vein is also present. Now you know about the Giacomini vein and some parts of the small saphenous vein. Please subscribe for more awesome anatomy and radiology videos.